According to a new study, a common irregular heartbeat called atrial fibrillation could increase the risk of dementia. In tonight's Health Beat, a local doctor tells us more about the findings and what you need to know about a-fib. A study published in the Journal of the American Heart Association finds people newly diagnosed with atrial fibrillation had a 13% higher risk of developing dementia, and the risk was even higher among those diagnosed before the age of 65, at 65%. So what exactly is a-fib? It's an arrhythmia in the upper chamber of the heart that can cause blood to coagulate there.
That sort of stagnation of blood, if your patient are not treated with anticoagulation, can cause a clot that eventually dislodges, go into the vascular system, and most of the time goes into the brain and cause stroke.
Dr. Andrea Natale is an electrophysiologist and the executive medical director of the Texas Cardiac Arrhythmia Institute at St. David's Medical Center.
When we see atrial fibrillation, we always worry about making sure that patients are properly treated.
Depending on the type of a-fib, treatment can be through medication or a surgical procedure where a catheter is inserted into the heart's upper chamber to fix the area causing the arrhythmia.
What we tell people is, don't ignore when something is wrong. Go and see your doctor, because it's not that obvious that you're having atrial fibrillation. Not everybody feels the heart flopping around and going faster. That's a minority of the patients that feel that.
Symptoms vary by person, but can include fatigue and shortness of breath. A-fib can be consistent or it can come and go. Statistically, in the Western world, 1 out of 4 people will develop a-fib by the age of 40, though it's more common between the ages of 50 and 60. Dr. Natale notes there is a genetic predisposition.
On top of that, there are environmental things that make the genetic predisposition to act up, and that can be aging, inflammatory process, hypertension, sleep apnea, being overweight. So especially in US, what we call metabolic syndrome is a big culprit in sort of activating the genetic predisposition.
Back to the possible link between a-fib and dementia, when looking at MRI images of the brain, blood flow is diminished during episodes of a-fib, increasing the risk.
So it's a multiple reason, from microclot to microbleeds, the blood flow to the entire structure that affect long-term the brain function.
Dr. Natale says people with a-fib who have symptoms of dementia are usually in their late 70s or early 80s, but it can happen to people in their 60s. To learn more about a-fib and its link to dementia, visit fox7austin.com and click on this story.